Hello, my name is Monica Hernandez, and I'm a Master's in Dietetics graduate student at UTRGV. My research question is, does immunity and infection susceptibility improve in women over 65 who take vitamin C supplements versus women over 65 that are unsupplemented? Vitamin C has a variety of well-known health benefits. The elderly population is at higher risk for low immune health. There are no up-to-date systematic reviews analyzing the ability of vitamin C supplementation's improvement on immune function that further reduces the susceptibility of infection. So my purpose and hypothesis: in the Hidalgo County, the population is growing, and especially the ages over 65. With age comes illness and increased medical costs for the area. I would like to know if vitamin C supplementation modulates the immune health of elderly women. So my hypothesis is that vitamin C supplementation does provide beneficial effects to the immune health of women over the age of 65. So the materials and methods: I utilize the Academy of Nutrition and Dietetics 5-step methodology for conducting a systematic review. I used two electronic databases. One was the PubMed and the other one was the PMC for articles published since 2017. This review includes an observational study and a randomized controlled trial among patients who are women over the age of 65 that were diagnosed with conditions that affect their immune health, that reported on the effects of vitamin C supplementation with pneumonia, type 1 diabetes, and the generalized immune response. So the eligibility criteria that I used for this research included vitamin C supplementation targeting participants who are women over the age of 65 who are suffering from low immune health. Included studies were those supplementing with vitamin C only rather than supplementing with a combination of different vitamins. For example, vitamin E and vitamin A were not included. Improvement of immune health in patients could be assessed with blood plasma samples, genotyping, and statistical analysis of oxidative stress biomarkers and its components. Observational studies and a randomized controlled trial were included in this systematic review. So the results show that there was an inverse effect of vitamin C within the immune and infection susceptibility within these patients. For the observational study, it did show an inverse correlation between protein carbonyls and vitamin C status. And in the randomized controlled trial, it indicated a correlation of vitamin C supplementation on the decrease in interleukin 6 pleiotropic inflammatory cytokine and an increase in interleukin 10 anti-inflammatory cytokine. So my conclusion is that vitamin C supplementation among elderly women has the potential to improve immune function and lower the susceptibility of infections, as evidenced by the apparent hypovitaminosis C in pneumonia patients, the diminished plasma ascorbic acid concentrations in type 1 diabetic patients, and the correlation of interleukin 6 and interleukin 10 cytokines among elderly women. Further research is needed to confirm whether vitamin C supplementation can improve health in elderly women. My implications for practice and research is that the immunity is a strong indication of health in individuals and possible interferences with conditions like pneumonia, type 1 diabetes, and COVID-19 that will affect the healthy patient. With the various types of immune health conditions, along with a very active pandemic of COVID-19 that the world has been undergoing, it is critical that finding additional supplemental interventions are discovered to help prevent and protect our immune response system. And that is all. Thank you